Good evening and welcome to RFL. I'm Andrew Whitman, in tonight for Richard French.
Shots in arms and money in pockets. That's important. The American Rescue Plan is already doing what it was designed to do, make a difference in people's everyday lives.
It's already happening as stimulus checks start hitting the bank accounts of Americans who are eligible, which is roughly 85% of taxpayers, according to President Biden. Today, we're going to start digging deeper into the relief package and show you portions of it that, frankly, aren't getting much attention. We spent a lot of time on this program last week dissecting the nearly $2 trillion package that President Biden signed last week, and we plan on doing the same this week. But instead of looking at the big picture like its poverty-reducing potential or how the bill will help people who need it the most, we're going to focus on particular aspects of the plan that just aren't getting as much attention as the headline numbers and programs. That includes things like housing and evictions, taxes, food and hunger, small business, and today's topic, Obamacare. The plan aims to increase participation by lowering costs and increasing access to affordable health care. In fact, the Nonpartisan Congressional Budget Office, or the CBO, says more than 1 million people will get covered and $35 billion in subsidies will be handed out to Americans. Plus, the rescue plan also offers incentives to entice holdout states like Florida and Texas to expand Medicaid, which would allow even more people to access coverage. Plus, many people will see their premiums plunge. The CBO says a 64-year-old making $58,000 a year is going to see their monthly premiums go from nearly $1,100 to about $400. A 45-year-old making the same amount will save about $100 a month on their premiums. Let's bring in our guest to discuss. Sabrina Corlette is the co-director at the Center on Health Insurance Reforms at Georgetown University. Sabrina, the pandemic seemed almost designed to attack our healthcare system at its weakest points. We're talking about a public health emergency over a deadly and debilitating virus, but most Americans' health coverage is linked to work, and millions of Americans lost their jobs during the pandemic. Do you have any numbers on how many people lost coverage because they lost work and what the impact on their overall health care was losing coverage because they lost work?
The numbers are still shaking out because we're still in the pandemic and a lot of employers are still suffering. That said, there are estimates that about 2 to 3 million people lost their job-based insurance because they lost their jobs. The good news is that because of the Affordable Care Act, there is more of a safety net than there would have been if this had happened 10 years ago. So we're seeing a big uptick in people enrolling in Medicaid, which is the federal state program for very low income individuals, but also increases in people enrolling in the Obamacare or state-based marketplaces, which is private coverage that's subsidized by the federal government.
So during the debate over the stimulus, we heard lots of complaints that the bill went a lot further than just dealing with the impacts of the virus. And you could make an argument that the expansion of Obamacare in the bill fits that group. So it sounds like you've already started to make the counter argument for me, but if you could just expand on why expanding Obamacare actually helps with our national recovery from COVID.
Well, number one is in the middle of a pandemic is not a good time to be uninsured. So the Biden administration and this new American Rescue Plan are taking a number of steps to try to make sure that more people are getting insured, which means that they won't face financial ruin if they do, God forbid, get sick with COVID. So first of all, the Biden administration has opened up what we call a special enrollment period. So even if you don't otherwise qualify, you can come in and get insured. And then it's also increased the subsidies available to help lower your premiums. And then for people who have qualified for unemployment benefits, not only lower their premiums, but also lowering deductibles and other cost sharing that you might face.
We also just got this bill after 4 years of Donald Trump. We know that Donald Trump worked hard to try and cripple Obamacare, both through policy and also through implementation and just executive decisions. Does this expansion of Obamacare reverse all that? Does it fall short of reversing all that? Does it go further than reversing it? Is Obamacare in better shape than it was before Donald Trump was president?
Well, I'll tell you, with this law, it sometimes feels like 2 steps forward, 1 step back. The American Rescue Plan does build on the Affordable Care Act, but the Biden administration and Congress still needs to do a lot more work to try to repair some of the damage that has been done to the ACA in the last 4 years. So more to come.
Now, I know you've hinted at some of this, but under the stimulus law, anyone who is unemployed will qualify for Obamacare, and they get to do so at a discount as well. Is that correct?
That's right. If you've received unemployment benefits or if you've been eligible for unemployment benefits in 2021, not only do you get a free marketplace plan, but you also qualify for a plan that will cover on average 94% of your costs. So your deductibles will be much lower. Any co-payments or co-insurance you might pay would be much, much lower than you'd typically experience.
Besides the newly unemployed, does anyone else now qualify for Obamacare coverage who was not eligible before the stimulus became law?
Yes. So before this law passed, the American Rescue Plan, if you were over 400% of the federal poverty line, which is a little over $100,000 a year for a family of four, you would not qualify for any subsidies at all. Under the American Rescue Plan, you now can qualify for subsidies. So we no longer have what people called this cliff that people would fall off of as soon as their income just exceeded this threshold. So I would encourage anybody, no matter what your income or your circumstances, if you have lost insurance or you're uninsured or just even thinking about getting covered, check it out, see what you might be eligible for. You might be surprised.
It sounds like there's an increased group of people who are eligible for financial assistance on Obamacare. Is everybody on Obamacare now eligible for financial assistance? Do we know what percentage of Obamacare participants can get that financial assistance?
We have a lot more people who are eligible. There are some folks much, much higher up the income ladder for whom they're probably not going to get much or even anything in the way of a subsidy. But I would say if you are anywhere up to 600% of the federal poverty level or 6 times the federal poverty level, you're probably going to get something. So it's worth checking out.
And Sabrina, one of the biggest surprises to me in the bill is that there's financial help for people who lost their jobs and had to lean on COBRA. Anybody who's been who's been in between jobs knows COBRA is their regular health care. It's just much, much more expensive, but now there's money available.
That's right. Typically, few people are able to sign up for COBRA because they have to cover 102% of the full premium, which for a family now is over $21,000 a year. So the federal government is going to pick up 100% of that tab through September 30th, 2021.
Finally, Sabrina, how much of this expanded Obamacare coverage is reliant on state participation? I know some states are being further incentivized to expand Medicare, and some states, including Texas, where we broadcast in 2 cities, continues to refuse to do so. What's the impact on these new Obamacare benefits in the stimulus if states don't want to participate in that expanded Medicare?
Right. So it's about 12 states that have yet to expand Medicaid. The American Rescue Plan gives them some financial carrots to step up and expand that program. And this is the program really for our lowest income people who really don't have any other source of coverage. It's hard to say. It's still voluntary for the states whether or not to take up this incredibly generous federal offer. I think there are some states that will turn it down for purely ideological reasons, and other states where the primary impediment has been a financial one. So this might just push them over and get them to decide to expand Medicaid.
But individuals in Texas will still be able to sign up for Obamacare if they meet those other qualifications, or somebody who's just out of work in Texas would still be able to qualify?
Yep. And I would encourage folks, especially if they've lost a job or had any unemployment at all, they can get great deals, so they should go check them out.
Sabrina Corlette is the co-director of the Center on Health Insurance Reforms at Georgetown University. Sabrina, thank you so much for the time and for guiding us through these changes. Really appreciate it.
My pleasure. Thank you.
Some good information on Obamacare. Up next, we pivot to COVID. I'll speak with the best-selling author of a book about the 1918 pandemic, and he'll explain why we should learn our lesson from the Spanish flu tragedy and keep our masks on right now and for a while further.